Professor Cholette, you conducted some fascinating research in a case study for Clinic by the Bay. What initially drew you to research this healthcare provider?
So first off, this was the first case study I'd ever written, and I probably wouldn't have undertaken it if it wasn't sort of prompted by necessity. So the backstory was that I had a previous case study that I had gotten off of Ivy, which is one of the big case houses, that involved event planning. But it was written back, let's say in 2003, and it just was not aging well. So I wanted to replace it. But the problem is there are a lot of cases out there, but most of them seem to focus on corporate strategy or launching a marketing campaign, and not so much on project management, which was the class that I was teaching. And so I was figuring out, okay, what am I going to do? And coincidentally, at the same time, I had a friend who was involved with Clinic by the Bay. What Clinic by the Bay is it is a nonprofit healthcare provider for what we call the working uninsured. So within the U.S., there is a large number of people who are working, whether it's part-time jobs or other sorts of things where they don't get healthcare provided by the company that they're working for, and they don't classify for government aid, Medicaid, so they fall through the cracks. So this clinic, there are others like it elsewhere as well, provides free healthcare for people like this, and typically doctors and nurses who are retired or near retirement volunteer their time for free, but there are also additional expenses. And the clinic does not get any funding from the government. So it is solely funded through corporate and individual donations. And how they raise money is typically through fundraisers. Well, in spring of 2020, when all of the lockdowns were happening, my friend who was on the planning committee for their event that was going to happen in mid-May of 2020, which was set up to be an in-person event, clearly that was not going to happen, and they were going to have to transition to an online fundraiser. And there's a lot of different steps that are involved in planning an online event. And everyone was kind of worried. It's like, can we make it happen? Will people want to show up online after, being in Zoom meetings for work all day? So I saw this was a case study in the making, and I decided I was going to document everything that happened.
Now, could you walk us through some of your key findings in the case study? What can the case study teach all of us about working with nonprofits?
Okay. So first, let's start off with the good news. The event team was able to successfully reorganize the fundraiser, which included lots of video testimonials from clinic medical volunteers and from the patients who were treated. They were also able to support a silent auction that now had to be done online. So no more paper bid sheets and all of that, but they were able to put the processes in place to make that happen. Lots of people paid to show up on Zoom and listen to online speakers and these video testimonials that had been recorded. They spent a lot of money on raffle tickets and bid up the items on the silent auction. So overall, the event met the fundraising target, which was about $250,000. And, of course, the event didn't go completely perfectly, but the organizers also learned from their glitches. So next year, May 2021, It was still slated to be completely online, but they were able to fix some of the problems from the previous year. So one of the things was switching the online platform from Zoom to YouTube. That avoided registration limits, and it also just avoided the whole problem of, oh, what's the Zoom link? Oh, what's my password? We've all gone through that, right? They also were able to focus their video testimonials and all on something that was very topical. So they in February 2021, before the vaccine was really just available to anyone, they offered a clinic to vaccinate their staff and their patients. And that really made a lot of sense, because when you think about it, theoretically, educators all had access to the vaccine in February, but most of us were teaching online. Whereas someone who is a cashier, she is in the front line. She is an essential worker, and she should have that vaccine before someone like me. So they had a very compelling story there. And they also, for their raffle ticket items and silent auction items, switched away from things like bottles of wine and gift baskets and all the things that are kind of cumbersome to deal with when you're 100% online, to other sorts of prizes. And in the end, that event was even more successful. They exceeded their fundraising target by a factor of 2. So the lessons learned from this is, I'd say, to simplify as much as possible. So cut out some of the less important details, streamline the operations as much as possible, and focus on what makes your organization unique and valuable.
Now, healthcare supply chains gained a ton of attention during COVID, especially due to the PPE shortages. What were the central issues supply chains were facing during the pandemic? In what ways might those challenges be relevant as it pertains specifically to healthcare coverage for low-income / working but uninsured Americans?
Well, there's a lot of issues within healthcare and supply chain as a whole, but I'd like to focus on an important subset of problems. It's when there is a crisis and the response to it. So getting the needed supplies at the right time. So I have a different study than this case study that looks at this a little bit, and it also involves students, and it's even more fun. So it's a game that students play when they take my operations management class or a supply chain class for me, where there is a scenario where there's been a bioterrorism attack, and 3 cities have been essentially car bombs have gone off in 3 different cities, and the bombs themselves didn't do much damage, but they spread weaponized anthrax spores into the air. And anthrax is fatal if it's been weaponized, but there is an antidote to it, but that antidote has to be administered very quickly once people start showing symptoms. And it may take a while for the symptoms to manifest, but once they do, you essentially only have a few hours. So the students have to figure out how to distribute a limited amount of medical supplies to these 3 cities, and they're also not sure how much supply they're going to get at any one time. So the crisis unfolds over several simulated days, and every few hours the students have to make a decision. We have a certain amount of supplies available. We don't know how much more we're going to get in, but of these supplies, how much do we send to each of the 3 cities? And so it's and they also get to compete with each other to see who makes the best decisions, which in this case is how many people were you able to save from dying from anthrax? And there's some interesting learning outcomes from this. One of the things that it becomes clear is you don't know what's going. Demand is very uncertain going into the game, but then as the crisis evolves, you have more information and you can make better decisions. Also, when there is supply uncertainty, that's even worse than demand uncertainty in terms of the overall impact that it has. So it's aside from engaging people, because there's one thing about studying inventory management and just looking at a bunch of formulas, but when you're actually making decisions and you can see the little red bars going up in terms of the number of people that have died during this simulated people that have died during this epidemic, it really hits those points home a little bit better than just punching numbers out on your calculator. And one of the interesting things that happens is that there are, even though this was a totally fictitious event, there has not been any car bombs with weaponized anthrax attacks in the U.S. A lot of the patterns that we saw mimicked what happened during COVID. So we did have huge shortages in our initial vaccine distribution. Part of it, some of it was because of quality control issues. There was one time when a contract manufacturer spoiled a couple million batches of the J&J vaccine because they got the formulation wrong. Then there was another time when blizzards shut down a lot of the transportation in the Southeast, which normally doesn't get blizzards. And this sort of roiled the vaccine rollout a little bit. And there were also problems where when people were playing the game, they might oversend some antidote to one city like Boston and then not have enough for New York. And the people in Boston wouldn't send their extra supplies to New York. And we see that kind of that sort of hoarding behavior as well in COVID vaccine rollout, in other sorts of crises. So the students get to see that better the ability to forecast, the ability to make more efficient supply chains, and maybe the ability to influence public policy. All of these things can end up impacting the medical crisis and just the supply chains associated with it.
I love the class project example. I'm curious, in your experience administrating that simulation or simulated project, I should say, what were the real levers or inflection points during the project timeline where the students who performed best in the activity made the right choice, and the students that performed the worst made the wrong choice?
I don't want to give too much away because I'm hoping to play this game, in a future semester. But the students who could look at how demand was evolving over time and kind of forecast and say, oh yeah. It looks like we have an increased demand, and that it's probably going to, if we look at this graph, it's going to continue to increase. Those students tended to do better, and also there was a little bit of it's perhaps useful to hold back some of your supplies initially when you're not sure how demand is going to roll out, so that you do have an emergency reserve to distribute if all of a sudden you are faced with an unexpected crisis. But one of also the lessons from this particular simulation is I set up all of the supply and demand figures such that if you did have perfect clairvoyance, no one would have had to die. But there's almost never anyone who is able to make those decisions perfectly. So there in a crisis like that, there will be some mistakes, and there's always possible for someone to go back and say you could have done better. But we can't expect perfection.
Now, I know you've taught here at SF State for about 22 years. When looking back, what has been a student project or experience that has really stood out to you?
Okay. Well, back to the whole question about healthcare and access for low-income communities, that got me thinking about a student research project that I supervised for 2 MBA students. And they studied how COVID vaccination rates varied within the Bay Area by community, and found that ethnicity was a big variable. So vaccination rates in communities of color were substantially lower than that of predominantly white and Asian communities. And by mapping the centers where the vaccines were available and sort of public healthcare outreach, it was pretty clear that these communities of color were underserved. So, we do not live in an equitable society when it comes to sharing healthcare resources during a crisis, and probably not in general, but this was demonstrated.